Hello, hello, hello. I'm Jean Tiberio, and I'd like to welcome you to Healing Outside the Box. I'm a nutritionist and a wellness coach, and I generally like to poke around on the World Wide Web and in my community to find both conventional and maybe unconventional ways for us all to feel better. If we can also come together as a community of like-minded people to live healthier and sustain our planet, well, that's just win-win all around. Now, sometimes the well runs dry, and I sit in front of the mic all by myself, trying to come up with ideas for topics that might be interesting. So I could really use your help. If you'd like to suggest a topic related to nutrition, food safety, meditation, or ways we can all bond together with other folks in the country and around the world, I am all for hearing about it. You can send a comment on my webpage, which is healingoutsidethebox.com/contact-us, or you can just comment under each particular episode on my website. I'll give you the links in the show notes as well. Today is episode 152, and I'm calling it Interpreting Your Medical Lab Tests. First, I should say that if you have any questions while listening to this, feel free to ask them in the comments section under the episode. But before we get into the lab tests, I'd like to make you aware of a new tech item that is out now. In this new item, we'll test your blood sugar without having to prick your finger. It's interesting because I was just talking about this with a nurse and we both said, it seems like it's time to come up with a technology that allows people to take their own blood sugar without sticking their finger. As we know, if we've had one, they have little thingies where you test your oxygen saturation by putting your finger inside of a plastic tunnel. So we already know how to measure oxygen saturation and pulse with that same method. The next natural step would be blood sugar. This would be huge, as our fearless leader would say, because it means that both type 1 and type 2 diabetes could be controlled much better with this monitoring device. And I believe your cell phone can then record and store all of the blood sugars so that you can see how your blood sugar level has been over any period of time. This also allows your doctor to have much more accurate information when you go to see him or her. I have to think that it will help people control their blood sugars, whether they have pre-diabetes or diabetes, because people could simply put their finger into the little plastic thingy before they eat, and if it seems a little high, they could simply try to eat less carbohydrates at their next meal. I'm going to try to get my hands on one of these and test it out for myself, maybe comparing it to a finger stick blood sugar meter. I will give you my honest opinion about it when I do. Okay, so you're in your doctor's office wearing that embarrassing hospital gown with the breeze on the back. Your doctor pulls out a piece of paper, or more likely stares at a computer screen, and tells you he or she is about to discuss your lab results with you. Are you going to stand by and let your doctor be the only one in the room who knows what he or she is talking about? I don't think so. Don't you want to know what those labs mean? Well, perhaps the thought of all those strange numbers can be a little overwhelming when you're sitting there in your hospital gown with a breeze in the back, feeling vulnerable. But it doesn't have to be that way. Today we're going to discuss some basic groupings of lab tests. We'll discuss what they are, the basic normal ranges for all those tests, and what it may mean if some of those are outside of the normal range. This will not turn you into an expert, and quite frankly, I'm not an expert myself, but it may help you feel more comfortable talking about these lab tests with your doctor. Now, I am in no way suggesting that learning this is going to substitute for quality physician care or your physician's opinion of those lab values. In my opinion, if you are equipped with some basic knowledge about what your physician is discussing and you have an interest in the subject being you, then you are better off knowing a little bit about these labs. And it might make any situation less scary if you have some knowledge about any, say, less than perfect results and what it might mean. I will put together a written list in the show notes, and I'll copy the list on my website, so you can copy and paste the range of normal values for these different labs. And again, I'm no expert in any of this, so I suggest you ask your doctor about specific labs that pertain to you. My goal here is to help you get a feel for what's out there and maybe feel more comfortable knowing what to ask your physician. So let's get on to it. The first group of labs I get asked about most frequently are the sugar testing labs. Your doctor may test your blood for sugar or test your urine for sugar to see if any sugar has spilled into the urine because of an overflow in the blood. Now, your blood sugar is tested frequently as part of a screening panel called a metabolic panel. Sometimes it's called a Chem 20 panel or Chem 13, what have you. Basically, this is a group of blood tests that screen for problems that could occur more commonly. And of course, blood sugar would be one of those. Now, the fasting blood sugar is called, not surprisingly, an FBS. Ideally, this would be less than 100, or you could also see 110 as considered normal. A fasting blood sugar of less than 65 or 70 would be the low cutoff point. Now, if you're not fasting, it's called a random blood sugar, and there is a lot of controversy about what should be the upper cutoff point for what we call an abnormally high blood sugar. Now, as the cutoff point, I have seen everything from 140 to 180. So that's something you should really talk to your doctor about. If you already have diabetes, your doctor may be more liberal and see 170 as a good number for you, but other doctors feel that treatment should be more aggressive than that. If you are pregnant, you will get a screening blood sugar checked in your second trimester, usually at about week 24 of the pregnancy. This is a screening test for what's called gestational diabetes. This is sometimes called a glucose challenge test or a glucose tolerance test. Your obstetrician will take a fasting glucose level, then ask you to drink a sugary solution. Your blood sugar will then be tested at 1 hour, 2 hours, and 3 hours after drinking that lovely syrupy solution. If your blood sugar during pregnancy is high, you will need to follow your doctor's instructions carefully regarding your intake. And this is partly because it gets tricky since you'll need to gain weight during those last 16 weeks of your pregnancy. Chances are you'll be monitored weekly and will be shuffled off to a nutritionist. Many years ago, I worked at a community health center as a nutritionist, and I saw many gestational diabetics. By the way, the numbers for gestational diabetics are on the rise as well. If you watch any amount of TV, you may have seen commercials for diabetes drugs. They will mention something called A1C, or hemoglobin A1C, as they call it. This has been added to screening panels. This A1C will give your doctor an idea about the average glucose in your blood over the past, say, 90 days. Although doctors love this test, my personal opinion is that what has happened in the past may help with the dosing of medication, but it is not helpful to prevent hyperglycemia and maintain normal blood sugar levels. The gadget I mentioned in the beginning would make a huge difference, again, in my opinion. Now, with these A1C values, the range for a healthy adult is 4.3 to 6.1. Anything above 6.1, and you may be checked for prediabetes or diabetes. By the way, this might be a good time to go over the symptoms of low blood sugar, which is less than 65, and high blood sugar, greater than 110 fasting, or let's say 180 random. The symptoms of low blood sugar are sweating, and this is often referred to as clamminess, which again, in my opinion, feels different than just plain sweating, as you would with exercise or being outside in hot weather. Another symptom is shakiness, rapid heartbeat, anxiety, and by this I mean really high anxiety. I've seen a few people with severe hypoglycemia, and they are absolutely frantic. It almost looks like they're having a panic attack. Eventually, if your sugar gets low enough, you could slip into a coma. Now, these symptoms are almost never seen with metformin, which is a common oral med for diabetes. Diabetics who are on the stronger meds or insulin may need to be aware of these low blood sugar symptoms. And usually I find that diabetics who are on insulin are fearful of these symptoms and sometimes confuse high blood sugar for low blood sugar. And again, I'll give you the links to these numbers in the show notes so you can get all of this in writing. Now, the symptoms of high blood sugar are, and I think everybody should be aware of these, increased thirst. Someone told me once that he felt like he wanted to drink out of a water hose. So that's not typical thirst. Also, fatigue is a symptom. And again, we're not talking about the kind of fatigue you have when you've stayed up until 2 a.m. watching investigative reports or binge watching Netflix. This is I can't keep my head up type of fatigue. Another symptom is frequent urination, which makes sense. Also, weight loss, if the blood sugars get really high and the sugar spills into the urine. Another symptom of very high blood sugars are blurred vision, trouble concentrating, and severe headaches. Now, on the subject of high sugars, a urinalysis can be done to check for something like a UTI or sugar in the urine, which means that the blood sugar has been high. Women in particular with chronically elevated blood sugars may be more likely to have either a UTI or a yeast infection because the sugar has spilled once again into the urine. And the yeast multiply because they feed on the sugar. Now, in a normal urinalysis, you'll see clarity as one of the tests, and it should be clear. Cloudy might imply a possible infection. Amber color might imply severe dehydration. If diabetes continues to go undetected, the frequent urination could result in severe dehydration. In the urinalysis, obviously glucose will be tested, and it should be completely negative. Ketones in the urine also should be negative. pH of the urine should be in the neutral range, and there should be no protein in the urine. Now, if there's protein in the urine, that could imply a possible problem with your kidneys. But don't worry, it will most likely be negative. Okay, so that was the sugar testing. Now let's go over some screening panels. As I mentioned, your physician will often do a metabolic panel, sometimes referred to as a Chem 20. This includes potassium, and potassium should be less than 5. Sodium. The sodium should be, say, 136 to 145, and they'll test chloride. Now, if potassium, sodium, or chloride are high in your blood, you may be just dehydrated. That would be your doctor's first guess, I imagine. So he will more than likely repeat the tests before he goes into more specific testing for kidney problems. Now, this panel includes carbon dioxide, which should be less than 32. A high carbon dioxide in your bloodstream may mean that you're not exhaling properly. A possible example of this might be if you have broken ribs. Because it hurts so much to breathe in, you might not be exchanging gases properly. Now, I have a problem with carbon dioxide because I have muscular dystrophy, and my breathing muscles are very weak. Other people with a high carbon dioxide level might be, say, people with COPD, chronic obstructive pulmonary disease. Now, here are more tests done in a Chem 20 panel. BUN, or blood urea nitrogen. Normal values for BUN are less than 20. Creatinine also is tested. Normal values, less than 1. If there's a creatinine level of 2.0 or greater, there may be some kidney dysfunction. This could be acute or it could be chronic. Obviously, your physician will discuss the details if your BUN or creatinine are high. The BUN and creatinine might be tested if a person has a suspected overdose of just about any type of drug. This would certainly be true of heroin or cocaine, But people who use, say, non-steroidal anti-inflammatory drugs like Advil, or even Tylenol to some extent, if there are high doses over a long period of time, these people could see their creatinine levels creep up. Tragically, if someone has attempted suicide with pills, they may have to undergo kidney dialysis to clean their blood because kidney function may have been interrupted. Now, here's more of these Chem 20 tests. We have glucose, and as I mentioned, the fasting is, say, 65 to 100. Albumin, this is a test for protein in the blood. The normal value is 3.5 to 5.2. If albumin is low, it could be a sign of malnutrition. If it's high, it could be a sign of possible kidney disease. You'll also see a test for total protein, which runs between 6 and 8. Now, you will also see your calcium being tested. The normal values I see are roughly 8.9 to 10.3. You would be correct in assuming that you don't want your calcium to be low because it functions to keep your bones strong and avoid osteoporosis. But the calcium value should not be too high either. And then we have magnesium, which is almost always normal, and a few other things. One of those other things is a bunch of enzymes that look at your liver function. Alkaline phosphatase is one of them. Anything that sounds like that is probably testing your liver. If these liver enzymes are high, your doctor will test further for liver malfunction, and it's possible you may just be dehydrated for whatever reason. The next screening panel is called a CBC panel. Here they're looking at signs of infection. You've got your white blood cell count, seems obvious. Less than 11 is a normal value. Red blood cell count, 4 to 5.2 would be normal. And then you've got your iron labs. They're called hemoglobin and hematocrit. If you've got a hematocrit that's less than 36, you might have iron deficiency and anemia. Then there's a bunch of other things in your infection panel that I won't bother to get into. These other values are less meaningful if you are otherwise healthy. And if you're sick, you should probably be discussing these labs with your physician. Now let's look at the cholesterol or lipid panel. Obviously, you'll see a total cholesterol. This is usually done fasting and should be less than 200. Now, some physicians might say 150, but that's pretty hard to reach with an American diet. Now, why would you ever need cholesterol anyway? It turns out it does actually have some functions in the body, and one of those functions is to transport your fat-soluble vitamins around in your bloodstream to where they're needed. Blood is water-soluble, and fat is fat-soluble. So these fat molecules, say vitamin A and D, need assistance and need to be transported around in your bloodstream. And cholesterol, as we've said, is fat-soluble, so it needs to form a ball of different substances so it can float around in your bloodstream. And these balls of different substances are called lipoproteins. So these lipoproteins contain cholesterol, fat-soluble vitamins, bile, and some other things. The first of these is the HDL, or high-density lipoprotein. And the normal value for this is, say, 40 to 60. Now, this is called the good cholesterol because it is said to control your cholesterol in your blood by transporting it to the liver to be destroyed when you have too much of it. Then there's the LDL fraction, or low-density lipoprotein. This should be less than 100, and some say less than 90. The lower the better. In higher amounts, this LDL fraction tends to stick to the walls of your arteries and add to the plaque. So LDL is the bad guy. And you'll see an LDL-HDL ratio on your blood work, and you want this to be lower. Less than 5 is ideal. Next, on your lipid panel is your triglyceride level. This should be less than 150. Triglycerides are the storage form of fat in your body, and this value tends to rise in diabetics. Now, without getting into too much detail, or maybe not much at all, your doctor will do an EKG, usually during your physical, This EKG will also read your blood pressure and heart rate. In terms of blood pressure, 140/90 is usually the cutoff point. Obviously, any information about your EKG should be discussed with your physician. But just so that you are aware of this, an EKG can help diagnose a heart attack, an arrhythmia, or even congestive heart failure. Now, a complete heartbeat will be measured with the letters QRST. And as you know, it goes boom, 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 boom. The top or highest bump is called the R peak. Now, if this heartbeat takes too long, it may be a sign of heart block. And this can be seen in congestive heart failure. So it's not a good thing. They call this a long QT syndrome. Another thing that is not good is called an inverted T wave. At the end of the heartbeat, there's a little tiny hill or a wave that normally goes up. If it goes down and it's a little valley, that's an inverted T wave. And it can be a sign of coronary ischemia, which means that your heart is not getting enough oxygen, or it could be a pulmonary embolism. And while we're talking about the heart, here are some risk factors for a heart attack or an MI. Number 1, unhealthy diet. Who would have guessed? Number 2, high blood pressure. Number 3, high blood cholesterol. Although, interestingly, that's not considered as important a risk factor as some of these other things. Number 4, diabetes or prediabetes. Number 5, smoking. There's your big one. Number 6, being male. Now, presumably, this is considered a risk factor because of higher testosterone levels. But it's also now known that estrogen could be a protective factor, which means that we're getting to menopause. Now, menopause will result in a lower HDL and lower estrogen levels. So that could be a risk factor for women. Technically, I wouldn't call it a risk factor, but they do, so I'm telling you. 7, being overweight or obese can be a separate risk factor. 8, being physically inactive. 9, having a family history of early heart disease. And 10, having a history of preeclampsia during pregnancy. Usually this is accompanied by high blood pressure and high sugar. About 50% of women with gestational diabetes during their pregnancy will eventually develop diabetes. My personal opinion about this is that we can learn to prevent that with behavioral modification. Oh, and the last risk factor is age, which we can do nothing about. So I can hardly call that a risk factor. Now for the liver tests. Here's the liver panel. Albumin, as I mentioned before. It's a specific protein. Total protein. If your total protein is high, it can also mean that you may have some liver disease. Now, bilirubin is also tested. That's made when your red blood cells break down. And your liver enzymes, like I mentioned, alkaline phosphatase is one of them. It's just a sign that your liver is performing normally. Now, your symptoms of liver disease include vomiting, jaundice, abdominal pain, yellowing of eyes, and something called ascites, or swollen belly. And you will have high liver function tests. Now, there's a controversy going on about cholesterol-lowering meds, especially the statins. Sometimes, if you're on a high dose of those cholesterol-lowering meds, you might see a rise in your liver function tests. Your liver function tests may also be high if you're a drinker or a drug user. Seems obvious. If you're morbidly obese, these liver function tests are going to go up. Long-term diabetes, you might see higher liver function tests. And there's a few other reasons which you should be discussing with your doctor anyway. There's one other specific test that you may see if you're on Coumadin, and it's called PT time or prothrombin time. This is your blood clotting time, and it's tested when your doctor is giving you Coumadin. Now, I understand that's a lot of information, but since you're going to have to sit through all of the television commercials, about these meds and what they could do to you, I think it's also a good idea to know what's normal. Obviously, if you have any specific questions, you should let your doctor know. And remember that their job is to help you understand these labs and other medical tests so that you can feel more comfortable with the results as they come in. That's all I have for you today. Be well and stay tuned next week for another episode of Healing Outside the Box.